Under Secretary General Cristina Duarte, Excellencies, dear colleagues and friends, in 2013, as Foreign Minister of Ethiopia and Chair of the African Union Executive Council during the 50th anniversary of the African Union and OAU, I had the honor to shape Agenda 2063 with colleague foreign ministers and former AU Commission Chair, Dr. Nkosazana Dlamini Zuma. The ambition of this blueprint for the future are bold, as they should be, and more than 10 years later, there is still much work to be done. The recent report on the implementation of Agenda 2063 shows that despite some progress, our continent is off track on many key indicators towards reaching the Africa we want. Progress remains slow in achieving reductions in maternal, child, and neonatal mortality, along with access to sexual and reproductive health services. While there has been a reduction in new HIV cases, there is still a high burden of old and emerging communicable diseases like m-pox, COVID-19, and Ebola. At the same time, there is a severe shortage of health workers on the continent, estimated at more than 6 million by 2030. All of this comes down to health financing. On average, only about 5% of national budgets are allocated to health, less than half of what it should be as agreed in Abuja, resulting in a heavy reliance on out-of-pocket spending. In fact, foreign aid has surpassed domestic spending on health in many countries, but as recent drastic aid cuts have shown, this should not be a basis for national health development. Further, aid tends to have a heavy focus on vertical program financing rather than health systems and essential health needs. Meanwhile, high debt servicing costs restrict government's ability to invest in health, education, water and sanitation, and other crucial services. This underinvestment impacts the education of future generations, reduces productivity, and contributes to keeping households trapped in a cycle of poverty and ill health. Moving past aid dependency is critical if the African continent is going to achieve its health goals. So, while recent drastic cuts in foreign aid is causing major disruptions, there are also opportunities. Many leaders and health ministers have told me that they want to leave behind the era of aid dependency and move toward sustainable self-reliance by mobilizing domestic resources. WHO is supporting countries to navigate this crisis and has long collaborated with the African Union in health, including through supporting the creation of the Africa CDC and the African Medicines Agency. We're working to support health system strengthening, including in domestic health financing, regulatory harmonization, local manufacturing, traditional medicine, workforce development, and digital health. The importance of building health system capacity and increasing global health equity was further highlighted by the adoption of the WHO Pandemic Agreement at the recent World Health Assembly. Dear colleagues and friends, health is an investment, not a cost to be contained. It's an investment in people, stability, and economic growth. Thank you all for your commitment to building stronger, more inclusive, and more resilient health systems for our continent. I thank you.